Hello, my name is Chase Lee McKnight, and this is my final presentation for Life Course Development class. My presentation is on schizophrenia. The American Psychiatric Association, or APA, defines schizophrenia as a rather rare chronic brain disorder that can cause delusions, hallucinations, or disorganized speech, or trouble with thinking and lack of motivation. I chose this particular illness because I know someone living with it. She is a senior citizen who lives in York. In both the world and the United States of America, schizophrenia affects approximately 1% of the population. Although it is fairly uncommon, it is one of the most disabling neurological conditions known to man. Anyone can have schizophrenia. Most people who suffer from the disorder start experiencing symptoms called psychosis in their 20s or 30s. If an individual experiences psychosis before the age of 18, their schizophrenia is considered early onset. Schizophrenia affects more men than women, and men typically experience psychosis earlier in their life than women do. Risk factors for developing schizophrenia include having a biological family member with the disorder, having an older father, having an autoimmune system disorder, drug use in adolescent or early adulthood, and complications during pregnancy or birth. Schizophrenia also tends to impact Latinos and Black people significantly more than other races. Studies show that Latino Americans are 3 times more likely to be diagnosed with schizophrenia than European Americans, and African Americans are 4 times more likely to develop the disorder than European Americans. Signs and symptoms. Schizophrenia often causes people living with the condition to lose touch with reality, behave or speak in a disorganized manner, withdraw from normal activities, have a difficulty concentrating or remembering things. Symptoms of schizophrenia include 1. Social isolation, 2. Disorganized behavior, 3. Aggression, 4. Delusional thinking, 5. Grandiosity, 6. Amnesia, 7. Anger, 8. Anxiety, 9. Apathy, 10. Feeling detached from oneself. 11. General discontent. 12. Loss of interest in normal activities. 13. Elevated mood. 14. Inappropriate emotional responses. 15. Hallucinations. 16. Paranoia. 17. Hearing voices. 18. Fear. And 19. Incoherent speech known as word salad. To examine how schizophrenia affects development, I will use Erik Erikson's stages of psychological development. More people who suffer from the disorder start experiencing psychosis in their 20s or 30s. According to Erikson, this would be young adulthood, in which human beings would be concerned with intimacy versus isolation. During this period of life, many people with schizophrenia experience isolation. This can be because they choose to isolate themselves or because people avoid them. Some people with schizophrenia might choose to isolate themselves because they are overwhelmed with what is going on in their mind, while others may be paranoid. As mentioned previously, paranoia is a common symptom of schizophrenia. Some people with the disorder may feel that demons are watching them at night, or that their friends are trying to kill them, or that the government is spying on them. In other cases, people might simply avoid them. There is a major stigma around psychotic disorders. Unfortunately, movies and television tend to paint people with these disorders as violent, perverted, and devious. Treatment. Schizophrenia is usually treated through a combination of psychological, psychosocial, and psychiatric interventions. Psychological interventions refer to talk therapy. Patients will sit down with a clinical psychologist to discuss their thoughts. Psychosocial interventions refer to interventions to help individuals reintegrate themselves into their communities after having a psychotic episode. Psychiatric interventions refer to prescription of mind-altering medications. In the case of schizophrenia, these medications would be antipsychotics. Antipsychotics block the actions of dopamine and affect other brain chemicals. Management. Currently, there is no cure for schizophrenia. However, it can be managed. Approximately 50% of people with schizophrenia who undergo treatment fully recover, and approximately an additional 25% make a partial recovery. The newest antipsychotic medication on the market for treating schizophrenia is lumateperone, also known as Caplyta. Lumateperone was approved by the FDA in December of 2019. It helps reduce positive symptoms by adjusting serotonin and dopamine levels in the brain. The following are resources available for people living with schizophrenia. Resources. National organizations. The Early Assessment and Support Alliance. The National Alliance on Mental Illness, or NAMI. Prodome and Early Psychosis Program Network. Online resources. SAMHSA Behavioral Health Treatment Services Locator. National Alliance on Mental Illness. National Suicide Prevention Lifeline. Shared decision-making information. Phone resources. The National Alliance on Mental Illness, NAMI. The number is listed. National Suicide Prevention Lifeline. The number is listed. SAMHSAS's 24-hour referral helpline. The number is listed. Thank you very much for watching my presentation on schizophrenia. The following are APA citations. These are the resources that I used when creating this presentation. I took information from the American Psychiatric Association, mentalhealth.net, the World Health Organization, PsyCom, the Mayo Clinic, Psychology Today, the National Institute of Mental Health, WebMD, Verywell Mind, the National Institute of Mental Health, and Medline Plus. Thank you very much for watching.